Good morning. This is Dr. Joshua Carpenter coming to you from HomeTown Direct Care in Shelby, North Carolina. And this video is meant to be an introduction to our practice. I've been meaning to do it for a while, just now getting around to it. But essentially what I want to do is give you an introduction to me and to the practice, to tell you how we're different, and hopefully just clear up some things that I think a lot of people have been wondering about us, because we are quite different. So a little bit of history. Our practice was started about 3 years ago in Cherryville, by Dr. Thomas White. He worked in the traditional system for 30 years and then essentially got to the point where it just wasn't working anymore for him and for his patients. So he found a better way, and it's this direct primary care model. So what that means is that the relationship is directly between the patient and the physician. So we don't allow any middleman to come in between that. So meaning that we don't bill any insurance. So we don't accept any insurance. Our patients pay a monthly or yearly membership fee, and with that they essentially get unlimited office visits. They come as little or as often as they need to. Our office visits are very different than the traditional office visit. They're much more relaxed. We schedule an appropriate amount of time. None of our appointments are less than 30 minutes. Some last up until an hour, and it's just a very different experience. We're not rushed, and we design it that way so that we can be very thorough and well researched, and allow the appropriate amount of time that is often required to provide good, high quality health care. We do a lot of blood work here. We include a lot of the basic blood work that you would need in the membership fee. And we draw that here in the office. Amanda, my nurse, draws that. And we include a lot of basic procedures, so EKGs, joint injections, skin biopsies, pap smears. We do a lot of that basic stuff that you could get at a lot of other primary care offices. And we include all that stuff as well in the membership. We give all of our patients our cell phone numbers, so when you call our office, you will be able to talk to Amanda, my nurse, directly, or one of our other staff members in Cherryville. If it's after hours, you have my number to get in contact with me if you need to, which is nice, because one of the things we value the most is continuity of care and access, and having a physician that you are familiar with and who you can rely on seeing every time you come to the doctor's office. So we'll give you a tour of the office here shortly, but you'll see that it's very different in the way that we've set it up. It's much more comfortable appearing. We have a waiting room, but it's more for looks than anything else. We rarely have people waiting to see us. We limit how many patients we take on, so we don't compromise the integrity of the model. So that's just kind of a general overview of how we're different. We're board certified family physicians, so we see from cradle to grave is what we say often in training. So babies all the way up to elderly patients. We pride ourselves on being able to take care of most things here in our office. But we also will still refer patients if we need to. We know our limits. We also have an online consult service that Dr. White and I both participate in. So a lot of times if we have a clinical case or scenario that we're not exactly sure where to go with next, we can type up the case and submit it to a board certified, you name it. So I've actually submitted quite a few skin lesions and rashes that I wasn't 100% sure on. I can send it to a dermatologist, and within 24 to 48 hours get a second opinion. And a lot of times that has helped us avoid unnecessary referrals. It's helped us develop better treatment plans, but ultimately it helps us save the patient money, and that's what we're trying to do. Like I said before, most of our basic labs are included in what we charge for our membership, but occasionally we will get some labs that aren't included, but we can tell you exactly what those labs cost before you even get it drawn, because we have a contract with the lab company and we have incredibly discounted prices, as opposed to if you just went to the lab and had them drawn yourself. So we're trying to take medicine back to kind of how it used to be, where you had your own personal family doctor. The cost was very simple and transparent, and hopefully we can take care of most of your healthcare needs here. Probably 80 to 90% we can take care of here. So that's kind of a general overview. So with that, I'm going to cut away and we'll go and start outside and give you a tour of the office. So we are located right here on 5 East Marion Street, right across from the old courthouse, now the museum, and we are right next to Toscano's, the restaurant. We're actually upstairs, along with several other businesses, and there is our logo on the door, or on the window, sorry. The door's right next to the logo. So we'll go on up here. So when you walk in, there's like a main area here. There is an elevator for our patients who cannot physically take the stairs, but of course we encourage the stairs for anybody who can. So we'll go up here and surprise Amanda, who is my nurse. So there's where the elevator gets off. So walk in here, you'll see our door. It's got mine and Dr. White's names on them. We'll walk in here, and there's Amanda. Hello, Amanda.
Hi.
Good morning.
Good morning.
So here's our main waiting area. Got a lot of local pictures on the wall. And then Amanda is my nurse slash scheduler slash secretary slash everything that I don't do in here. We have a couple of exam rooms that we use. This is our smaller one. We use it mostly for drawing blood right now. We got a nice view of uptown Shelby. And then this is our main exam room that we use. We got some old pictures on the wall in here. If you don't know, this building actually used to be the old fire department and city hall, so we got some old pictures on the wall to recognize that. And this room has a nice view of uptown as well. We have a big TV in here. The reason why is for several things, but one of the things we use it for the most is if we do some blood work on a patient and we get that back and we want to review it in detail, we can put those labs up on the screen and discuss it with the patient in more detail. I've also used it for some anatomy pictures, for videos, so it's a good resource to have. All right, so that's pretty much it. We're not a very big operation, but it's really all we need. And we're obviously very different, as you can tell. One thing that we're currently offering is a free meet and greet. So If you want to come to the office, sit down with me, meet Amanda, and discuss any further questions or concerns that you may have, we offer that free of charge, 30 minutes with no strings attached. So if you decide it's not for you, then that's okay. If you decide it is, then we can sign you up that day. And then let's say it gets 3-4 months down the road and it's not working out. If you have to end your membership, all we do is just refund the unused portion of your membership. So we want it to be a good fit for all of our patients. And fortunately, we rarely have people leave. If they do, it's for financial reasons. But the other thing that I wanted to mention is that we are currently working with several local employers. It's worked out really well for these businesses who want to offer some kind of health benefit to their employees, but either they can't afford traditional health insurance, or they do offer some health insurance coverage, but they want to offer this benefit as well. It's worked out really well. We worked with smaller and larger employers, and then we're actually in discussion with a few more. So we're open to that as well if you want to get in touch with us. We have a Facebook page, so if you go to Facebook and just type in the search bar HomeTown Direct Care, you should find us there. We also have a website, HomeTownDirectCare.com, which we're currently updating, but you should still be able to access the old website. And there is where you'll find some more detailed information on pricing and other things as well. But that's it. I appreciate your time and watching the video, and we look forward to hearing from you.